Spiritual encounters are real in mental health crisis care. Are we aware of religious and spiritual experiences? We are the coalition of mental health, religious, and spiritual leaders on mission to prevent misdiagnosis and establish support.
One of the first things that happens as soon as we use the word spiritual is people begin to think immediately about religion. So we want to clear this up at the beginning. By religion, we're talking about an institutional aspect of beliefs and practices related to sacred or divine, where spirituality is a dimension of personal human experience that also may be transcendent, and it may occur in religious communities and traditions. And then in the research, there's also the term religiousness, is systems of beliefs and practices related to the sacred that may not be related to a specific group. This would be an example. Someone may do yoga and not identify as Hindu, or they may pray and not necessarily connect with Christianity.
Are we aware that 49% of US adults say they have had a mystical experience defined as a moment of sudden religious or insight or awakening? Are we aware of Dr. Stan Groff and his original book on spiritual emergency? Have you heard of these terms? Hyper-religiosity, religious preoccupation, religious fanaticism, out of touch with reality, and spiritual encounters.
Are we aware of the V code or the Z code in the DSM, religious or spiritual problem, that was introduced in 1994, and in 2025 the term moral was added to identify moral injury. And this is not in the diagnosis categories, but this category is used when the focus of clinical attention is a moral, religious, or spiritual problem.
Do we consider context and culture? What may be seen as spiritual awakening in one culture could be viewed as psychosis in another. It is essential to consider the individual's cultural background and beliefs. Certain cultures may use spiritual religious considerations to explain psychosis. Have you ever noticed that religious or spiritual language is in a mental health crisis call? Spiritual experience is a private, individualized experience that can be a source of awareness, purpose, or a new perspective on life. On the other hand, spiritual crisis could be a period of questioning that can lead to a change in how someone views life. It could be a form of identity crisis that can involve feelings of anger, depression, or anxiety. And it can be a time when someone may question the meaning of life or their beliefs. Yet spiritual emergency is a period of intense experiences that can be difficult to handle. It could be a time when someone's sense of reality and ego may collapse, and they may be open to a different reality. It could be a time when someone may experience altered states of consciousness, visions, and other sensory changes. It also could be a time when someone may feel overwhelmed by past trauma or conditioning.
And this is what we mean by spiritual experience. It's a non-ordinary experience that may include an ecstatic mood, a sense of newly gained knowledge. It may include, as was stated, perceptual alterations and hallucinations, extreme ideas with themes related to mythology or religious traditions, and there usually is an absence of conceptual disorganization or an absence of cognitive disabilities or deficits, and most cases there is an absence of suicidal or homicidal ideation. As was just described, the spiritual experience may progress to spiritual crisis, spiritual emergency. It can easily be misdiagnosed as a medical or mental disorder, and importantly, it is a real missed opportunity for growth. Some of the things simply to differentiate psychosis and spiritual experience is psychosis has a prolonged onset, whereas spiritual experience is usually recent with a rapid onset. Psychosis has a prolonged disturbance in thought, emotion, and perception, whereas spiritual experience has short or episodic, though it is intense. With psychosis, there's an altered sense of reality, usually resulting in distress with negative changes, a global cognitive impairment, and decreased insight, whereas spiritual experience may have an altered sense of reality, but it has positive changes. There is limited overall cognitive impairment, and it can be transformative. The spiritual experience usually increases functionality, and the psychosis usually decreases functionality. And then finally, spiritual experience adds a sense of connectedness, a purpose, an inner peace, clarity, and improved insight. Clinical red flags in spiritual experience that sort of suggest that there may be more of a psychosis related to mental illness would be alert to command hallucinations, unsafe behaviors that are demonstrated by the client, loss of reality testing in commonplace activities of daily living, severe functional impairment, psychomotor agitation with a negative mood, and a cultural mismatch with their risk behaviors, different than their culture, and they're doing things out of line with those beliefs and practices.
Well, what does help look like in a 911 or a 988 call? We believe this is a simple model to first just humble ourselves, empathize, put ourselves into the conversation where we're listening and have patience. How do we respond to a spiritual emergency? Well, these are some simple first steps. Well, obviously, we want to de escalate and definitely determine that there is no imminent danger to self or others. But to the individual, we really believe that we can ask the question, do you sense something spiritual or religious is happening? Ask the individual, would you like to meet with a chaplain, a clergy, or peer support? And then when we're talking to friends and family, or even at the ER, do you know that there is a DSM code called moral, religious, or spiritual problem? And then lastly, would you please make sure that this is noted during screening and on the medical report as a condition that may be a focus of clinical attention? So next steps after this brief orientation is that we want to continue to orient peer support chaplains on the ER, peer respite staff, first responders, family and friends. We do offer 2, 4, 6, 8 hour A.W.A.R.E training where we get into the detailed competency. We offer one-on-one coaching on spiritual emergency for individuals, therapists, and families. And we also invite conversation into a docu-series that we're filming at the College of New Jersey and throughout New Jersey. We have a list of A.W.A.R.E films, orientations, and resources that you can review after this orientation. In our education and training, we offer case study review, research review. The help model, we actually go into skills practice. We have spiritual assessment tools, the FICA spiritual history tool. We have spiritual experience scales and conversation tools to work with one-on-one. We do have treatment and care alternatives, outpatient and discharge to community resource steps, and we have the open dialogue discipline and applications. This is a draft in process, and we like to invite the audience to ask yourself, how might this be useful just to open a conversation in a medical office, and how would we improve this? You may contact Dr. Calvin Chatlos and myself, Janet Werner, at these resources or links. And we close with